Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center here in Mount Pleasant, Texas, and today's Thursday, September 2nd, 2021. We're on a day earlier this week. Tomorrow I'll be off to celebrate my father's life as we have a memorial service tomorrow in Austin in his behalf. So I'm excited to come to you tonight. Just wanted to give an update before I leave town so everybody's on the same page. I want to appreciate all our team members and our doctors for the work in the last 7 days. I'm blessed. I have the ability to sit back and watch some amazing things each day. From last night, what our security team did, our emergency department team, to doctors coming in on their days off to help out, to ambulance drivers working extra shifts and doing some extra jobs to help out around the health system. Our team members are heroes, and I'm truly appreciative of them, of the things that they're doing during this pivotal crisis that we're dealing with. Tomorrow, Titus Regional Medical Center will join the Texas Hospital Association and the Dallas Council on Hospitals in doing 5 minutes of silence at noon tomorrow, Friday, September 3rd. We're going to do this moment of silence in honor of everyone who's passed away for COVID, for the healthcare heroes over the past 17 months who've given selflessly for this virus, and also for the efforts that are going on to prevent and mitigate the spread of this virus. We would appreciate everyone tomorrow at noon to say a quick prayer, to take a moment of silence and just think about the last 17 months and just say thanks for everything that you've been given and everything that we've been given. I will definitely be taking a few minutes tomorrow to just remember the friends we've lost and the friends that we've saved over the last 17 months. It's a few minutes late today, and I appreciate you joining us, and I appreciate the members who join us live every week. We have a pretty loyal group, and a group that I consider ambassadors for healthcare in Northeast Texas, because you're taking this information, you're getting out, and there's a difference being made. We are still seeing an increase, and that's one of the things I want to continue to look at. From a numbers perspective, you notice that's not Mount Pleasant. I'm looking at Tyler and I'm looking at Dallas. One of the things I keep getting asked is, when are we going to see the peak, or when are we going to see a decrease? One thing we've seen over the last 17 months, except our first surge, we've been about 2 weeks behind our friends to the south and our friends to the west. So I watch their numbers closely in Tyler, and I watch our friends closely in Dallas to see what they're doing. And as you can see, over the last 2 weeks, consistently increase. There's not been a decrease, and they're still up there. So from our perspective, I'm consistently thinking we've not even close to our peak, and we still have to prepare for the things that we're doing right now and for the increases. As of this morning, a few minutes ago, we have 24 patients with COVID in our hospital, 19 on the floor and 5 in the emergency department. We're also holding a few more patients in the emergency department that are non-COVID, but we just don't have room in the hospital for them. So our emergency department has become another part of the hospital. This is not atypical of just us. We've seen this at hospitals around us, but we are keeping our hospital doors open, our emergency department open. We are continuing to do surgeries across the hospital because there's people in this community who need those surgeries, and we want to make sure we get them taken care of. But as those numbers continue to increase, I will continue to make sure we push for vaccinations and wearing masks. Dallas, from another perspective, continues to go up. The line's not as steep as the Tyler area, but the numbers are higher in that area. So when you consider Dallas and you consider Tyler, we're still 2 weeks before we even see any type of relief. So into September is what we're looking at right now, hopefully, before we'll see any type of relief. And the relief, I truly believe, is going to be about vaccines. And I'm not going to get on soapbox today, and I don't want to get into politics, and I don't want to get into the religious piece of it. I do want to talk about vaccines. And from a numbers perspective, we continue to increase. We're from a 1-dose eligible, Titus County is up 36%. We're continuing at 48%, and a 30% full vaccination. But that 48% is above our region by 3%. That's a big deal. I appreciate everyone in Northeast Texas, especially Titus County, Mount Pleasant, who's gotten the vaccine, encouraged their family members to get the vaccine. Because I'm going to say something that's not politically correct. This Delta variant has become a disease of the unvaccinated. I was on a meeting this morning with a phone call, and I know people will take that comment and not like it being said from the politics involved. But I can tell you the numbers from across the state of Texas, from the hospitals. 99% of all mortality is happening in unvaccinated. More than 92% of all inpatient hospitals are unvaccinated. But over half the state of Texas is vaccinated. So that's just telling you that even though there's concerns about the vaccine, and even though that there's unknowns, that people who are vaccinated are not getting as sick and are not dying and are not increasing the hospital bed needs in Northeast Texas. I'm not trying to get into politics, but as you talk to your friends, you talk to your family, it's amazing to me when young couples, and one of our reasons our vaccination rate is so low is the younger community, people much younger than me. And those are the people that are in the hospital right now. But when somebody gets pregnant or somebody in their family is getting pregnant, the first thing they do is get vaccinated to protect them. Guys, I encourage you. I beg of you and I implore, vaccination does reduce the risk of becoming very sick and mortality. It does not stop COVID. So I don't have to see any texts or somebody go comment online and ask questions. I can still get COVID and vaccinated. Of course you can. And I was very concerned when COVID was near me and I'm vaccinated. However, we've seen minimal people in the hospital who have been vaccinated, and we've seen minimal people get real sick who've been vaccinated. So the vaccine is an opportunity to mitigate it in there. I don't want to get on a soapbox today, but I just want to make sure that everybody understands it and sees it. From a booster perspective, it's confusing. And I'm going to tell you guys, I eat, sleep, and drink this stuff, and I apologize, but I do want to make sure you know what we know. The third shot is available if you are immune compromised and have any types of those issues. Please work with our vaccine clinic and they'll get you your third shot. The booster is kind of on hold right now. The FDA has not approved a third shot, and that has not been approved by them. The White House is pushing for a third shot to come in November, but it has not been approved. So once we get more detailed information and an approval of a third shot, Titus Regional will work with the state of Texas and all the vaccine carriers that we've had before to make sure we're giving that third shot, whether we call it a booster or a third shot. We will give it, but right now we're still not giving it. We're only doing it, the third shot, for the people who have one of the 6 criteria that we've talked about. I would encourage you, if you get a chance, to go to our Facebook. Bobby and Tracy and Dr. DeLisi have been working over the last few weeks to put some more information out there. On a daily basis, Dr. DeLisi is going to answer some questions, some things that he's seeing in the clinic. He has seen more patients over the last few months. The Family Care Center, all the providers over there are seeing the increase over the last 6 to 8 weeks. A lot of questions they get on a daily basis, and he's tried to sum those up in some vignettes and some small things just to get that information out there. So I would encourage you to do it. I respect it. I love Dr. DeLisi. I enjoy every opportunity I get to hear him talk. But please join us on Facebook and just look at those vignettes. I think they're putting a different one out every day, trying to keep them small for people like me who get easily off to something else. So encourage you to go to Facebook and take a look at them from there. Our vaccination clinic is still open. It's Monday through Thursday. It is at the Wellness Center, the Medical Plaza to the west of the hospital. Please go over and see the ladies over there. Get your vaccine, get your second dose. We appreciate the Titus County Fair. Will be in a few weeks, and they're going to allow us to do vaccines at the fair. So we're excited about that. We won't miss an opportunity to give vaccines in this community. We'll jump at every opportunity we have to mitigate the spread of this disease. I want to thank our friends at All American Testing. They're continuing to work hard next door to the hospital. If you need a PCR test, they are having PCR tests on the south side of the hospital off 20th Street, right at the corner of 20th and Johnson. But you can go online to allamerican.com and get an appointment. But they're doing a great job in the heat on a daily basis from there. I have one question here I just want to address, and I'll go back, is what is the booster shot? I mean, what's the point of giving the booster shot? 2 things. There's a third shot and there's a booster shot. The third shot is right here, and there's 6 categories of getting it. Cancer treatment, transplants, or certain type of deficiency diseases qualify for that third shot. The booster is a name being given to a third shot 8 months after you receive your vaccine. Johnson & Johnson has not discussed if they'll have a booster or not. Moderna and Pfizer have discussed having a booster. It has not been approved yet, but there's a lot of information out there, and people are confusing third shot and booster. Third shot is for this 6 criteria. A booster shot is 8 months later, and it's still under discussion. So I just want to make sure we clarify that up there. I would encourage you to please join us next Friday. We'll go back to weekly Fridays and join us as we continue to get information to you. If you have questions, please use Facebook to send us those questions. We'll try and get them clarified on a daily basis and get those out there. And again, please join us at noon tomorrow as we take just a moment of silence just to remember this past 16, 17 months. And also say thank you to the good man above for allowing us to stay healthy and to get through this. And I appreciate Northeast Texas. We appreciate you joining us. God bless.